If it comes back, let's say at least 126, so and on 2 occasions, so it's confirmed that they have diabetes, what sort of information should they seek from their doctor, or what referrals to community resources should they ask for?
Right. So the way that I approach it is really based on what kind of symptoms is the patient experiencing. So if this is someone, for instance, who is losing weight and it's unexplained, and the reason that that can happen, so let's take it back a second, and someone's eating quite a lot, more than usual, but they're losing weight, and they think, oh, I've hit nirvana, I can eat anything I want, and I'm losing weight. No, it really isn't. What's happening is that you're wasting a lot of calories because the blood sugar spills into the urine. You waste those calories, and so you can lose weight, but the bloodstream is still high with the blood sugars, and it's making you dehydrated, thirsty, and hungry. So if someone's feeling symptomatic, blurred vision, I can't sleep at night, I'm getting up constantly to go to the bathroom, I wake up tired, I have unexplained weight loss. Men and women can have yeast infections that can affect the genital area, so women typically having vaginal yeast infections. So any kind of symptoms, that would prompt me to then think about using medications earlier than I might otherwise if someone's coming in and we find diabetes, but they're really asymptomatic. They're not having any of the symptoms we just talked about. So the first order of business is making the diagnosis, assessing how symptomatic the patient is, because you can really improve the quality of their life very quickly if you can make their blood sugars closer to normal. Then it's how to monitor their blood sugars, how frequently to do that, nutritional counseling, use that in coordination with someone, perhaps there are other medical problems if they have to reduce fat intake for cholesterol or triglycerides or hypertension, things like that. So I would say it's how to monitor their blood sugars, nutrition is key, and then where do you incorporate exercise.
Do you find it helpful if they can locate a diabetes education program at a hospital?
Yes, I think so. I think since the vast majority of patients in the United States who have prediabetes or diabetes are cared for by primary care physicians, family practitioners, that having those resources as a diabetes education center gives that physician expert resources to help give more information to patients. Because really I've had so many experiences where you make this diagnosis, it's really overwhelming for the patient on their very first visit. Even if you've allocated 45 minutes to an hour to be with the patient to talk to them about what's occurring. That includes the initial assessment, the physical exam, let me tell you all that you need. They oftentimes are only hearing just a small fraction of what you're counseling. So to have those resources, the diabetes education, they'll go back and confirm good technique on how to do the finger sticks. Maybe it requires how to administer insulin, how to drop a syringe, or use the newer devices such as the pens or pumps and things like that. And then even how to incorporate diet, carb counting. It can get overwhelming when you start to talk about simple carbohydrates, complex carbohydrates. So those additional resources are really terrific.
A lot of people like to turn to the internet. Mm-hmm. Are there any reliable sites you can recommend? Yeah,
I would really recommend the ADA website, so the American Diabetes Association website. That's really their first stop. That's the authority really that should be able to speak to them, because it's very good for professionals, but also for the public. WebMD is also an excellent resource.